If sleep has become harder to come by lately, you are not alone. You might fall asleep easily, but then at 3 a.m. you find yourself wide awake and restless. Or do you toss and turn at night, feeling exhausted but unable to switch off? Or maybe you wake up feeling unrefreshed, even after what should have been a good night's sleep. For many women, sleep is one of the first things to change during perimenopause and one of the most frustrating. Today we're bringing together some insights about sleep, from why it changes in midlife, what's happening with your brain and hormones, how alcohol impacts your sleep, and hacks that will actually help you get a better night's rest. You'll hear how hormonal shifts affect your sleep architecture, how alcohol actually inhibits your ability for deep sleep, even though you might feel like it's helping, and 5 hacks to improve your quality of rest. This episode isn't about chasing a perfect night's sleep. It's about understanding your changing body, working with it, and creating a sense of calm and confidence around rest. As always, this information is general in nature and not intended to replace personalized medical advice. Please speak with your healthcare provider about what's right for you. Let's get into it. Today we're going to talk about sleep, and so many women our age struggle with sleep, but so many people generally, even kids, can really struggle with sleep. Older people can struggle with not being able to sleep, and it's one of those things that actually can make you feel really lonely during the night. It feels like the rest of the world's sleeping and you're the only person who's awake, and sometimes our minds are just racing, and other times we don't really understand why we can't sleep. But how much sleep should we be having? What's the optimum? Is there any consensus?
That's a really great question, insofar as that's what people hope to get a kind of snippet of an answer. However, there's actually no such thing. There is no such thing as the ideal amount of sleep, and there's no such thing as, the perfect amount of deep sleep, dream sleep, all manner of things. So in answer to your question, the evidence suggests that actually the amount of sleep that we need varies enormously, depending on life stage, depending on what's going on in our life. But there are some very good recommendations. And so what I'm about to kind of say as the answer to the amount of time you should sleep is based on recommendations from the Australian Sleep or the Sleep Health Foundation. And so for adults, it's somewhere between 7 to 9 hours. And for school-age kids, so kids about 6 to 13, is somewhere around 9 to 11 hours. And for teenagers, somewhere between 8 to 10 hours. So these are general recommendations, and they're recommendations based on what we know is an amount of sleep that kind of is necessary to be able to function well, to be able to think, keep your emotions under check. However, what we also know is that sleeping significantly more than that, or sleeping significantly less than the recommended guidelines, is also associated with a whole range of different health issues. So if I say to you 7 or so hours, that's just a ballpark figure. Now, you've got to take into account all manner of different things, and that might vary. Does that offer an answer, even though it's not the perfect answer?
No, it does. And so interestingly, tell me a little bit about what happens when you have too much sleep.
Sure. There are typically conditions associated with oversleeping. Okay, and so oversleeping is often atypical, and you'll understand what I mean this from a clinical point of view, and that means that it's not a common presenting symptom, but it's certainly a presenting symptom of conditions like depression, for instance. So it does suggest that perhaps you have a typical type of depression, and therefore you're oversleeping. It's also associated with thyroid dysfunction as well. So things that are conditions, I should say health conditions that are associated with oversleeping are indicative of that. People who chronically undersleep or who have periods of significantly undersleeping may well be associated with, onset of bipolar disorder or something like that. So it just suggests that things are not as they should be. We certainly know that children on the spectrum, for instance, have difficulty with sleep. They tend to have difficulty falling asleep. They tend to, wake up a lot during the night. So anything that's not within the realm of the average suggests that something else might be going on. It's always worth going to your doctor if you're noticing something that it's like, I normally sleep X amount, and then all of a sudden I'm sleeping so much more, or I'm sleeping so much less.
And what are the health risks of undersleeping? So if you're not getting enough sleep on a chronic basis, I mean, I think we all know anecdotally that we're probably going to be not our best selves and we're going to be pretty grumpy.
Yep.
But are there any actual sort of physical health concerns about not sleeping enough?
So not sleeping enough is associated with other conditions that are often lifestyle related, especially if it's chronic. So things like cardiovascular disease, things like obesity, they're associated with, disrupted sleep because they disrupt appetite and so on. So, the system, as you know, is all together. You can't just sort of talk about sleep without talking about its impact on appetite, for instance, or decision making. If you're tired, you tend to be more impulsive in your choices and what you want to eat. You tend to want to eat more carbohydrate-rich food, so you're more likely to gain weight. And so that's, one way the relationship goes. In terms of teens, for instance, it impacts academic performance, which, may lead to perhaps premature leaving of school or other things that might have cascading on impact. So there are both physiological as well as psychological impacts and even lifestyle consequences. But in terms of some of what the research has taken from the lab and what it translates to real life, sometimes it's been difficult to know. So certainly we know that if you undersleep, the immune system tends to be a little bit compromised. As you probably know, there's more release of body repair approaches while you're sleeping. So if you're sleeping less, you tend to have less recuperation. But it doesn't always translate on a bigger scale.
One of the things that I see is women's really struggling with sleep. In fact, it's probably one of the biggest issues, and it's probably one of the things that I prioritize, certainly as a doctor, to try and get women sleeping again, because I think whenever you're sleeping, it just changes the trajectory of so many aspects, physically and mentally. But what I also notice is two things. One, a lot of women actually think that alcohol will help them get to sleep, and it probably maybe helps you fall asleep, but what I find is that it's waking you up, and that I would say like 2:18 or 2:44 you're bing wide awake and usually not feeling great. Do we know why that is? Why does alcohol suddenly seem to wake a middle-aged woman up where maybe if she had drunk before she would have slept right through?
And I think there's a couple of things there. So yes, alcohol might, because it has such a sedative effect on the brain and the body, we might pass out and fall asleep easier. But as Matthew Walker, the sleep specialist, says, sedation is not restorative sleep. And so while you might be passed out, you're not getting the benefits of a good night's sleep. Second thing is alcohol causes our cortisol to rise, which is the stress hormone, in response to the big surge of GABA that's been created by the alcohol. So we drink alcohol. There's a neurotransmitter called GABA, which is our calming, our relaxing neurotransmitter. As we age, women produce less GABA because of the drop in progesterone, and GABA and progesterone are linked. So we're feeling more stressed and anxious. The GABA response we get from alcohol causes us to unwind and relax in that moment. The brain doesn't like having such a big surge of GABA in one go, so it releases the opposing neurotransmitter cortisol in response to try and create some balance. And then also the alcohol's got the sugar in. So what tends to happen by the time it gets to your circadian rhythm, the time that is working on your liver is usually between 2 and 4 a.m., where your liver is processing the alcohol, processing the sugar. You've got more circulating cortisol, the stress hormone, and that's why we will often wake up. And then we will find from there that we'll have very fragmented sleep and really struggle to get back into a deep restorative sleep. And we also know that alcohol prevents us from getting any REM sleep. And REM sleep is the stage of sleep that's associated with dreaming, but also responsible for emotional processing. They've done studies on people, even after one drink, just one glass of wine, they've studied their brain while they're sleeping. Let's say we have 6 sleep cycles in one night of sleep, only one of those after alcohol will go into REM sleep, and the other 5 bypass it. So if REM sleep is responsible for our emotional regulation and emotional processing, then again, that makes sense why we have, consistent drinkers, not heavy drinkers, but consistent drinkers will start to find that their mood and general mental well-being starts to deteriorate. And we just feel tired. Like the background vocabulary to my life was, I'm not hungover, I'm just tired. I just never felt like I caught up enough on my sleep. And that's because alcohol causes us to not really get any kind of restorative sleep, even just one drink.
Absolutely. And certainly women of this age are already feeling very fatigued. Lots of people are complaining of muscle aches and pains and joint pains. And, don't get me wrong, I absolutely am a big advocate for hormone replacement therapy, and it can be miraculous, but it's kind of nearly like by drinking, even though for all the benefits you're going to get with hormones and all the benefits to your mood and your fatigue levels and things, you're nearly counteracting it if you're then also drinking every evening. And I actually had a patient on Saturday, it was Friday. She showed me some before and after pictures. So she stopped drinking just over 3 months ago, and it was just the reduction in puffiness of her face. And it's something that I've seen so repetitively in patients, and it's just hard to pinpoint, but it's just very noticeable that alcohol definitely gives people this sort of generalized puffiness in their face. So, it's impacting everything from, your mental well-being, your ability to regulate your moods and not fly off the handle, to, having skin changes and a puffy face. And again, I look after a lot of women with skin conditions like rosacea that have been made worse by menopause, but rosacea is also very heavily connected to alcohol. It makes it worse a lot of the time. And, so again, these things are, when we're like trying to do all these treatments over here with skincare and lasers and all sorts of things, but then the person's still drinking, half a bottle of red wine every night. And it can just feel like we're going round in circles.
Absolutely. And I run women's alcohol-free challenges 4 times a year. And we usually have between sort of 600 and 800 women in them. And they all take a photo on day 1 and then a photo on day 30. And honestly, Shauna, the change in their face just in 30 days, like how much their skin is glowing, how much leaner their face is and healthier their skin looks, the puffiness goes, and their eyes are just bright and white and wide, and they just look so much healthier. And that's just 30 days of not drinking.
That's amazing. This episode is brought to you by my 16-week Rediscover You program, designed specifically for women navigating the challenges of perimenopause and menopause. If you're dealing with disrupted sleep, mood changes, or unexplained weight gain, this evidence-based program combines medical guidance, practical tools, and a supportive community to help you take control of your health. Women have reported significant improvements in symptom management of sleep quality and overall well-being. As an All About You listener, when you mention the podcast, you'll gain priority access for our next intake. Click the link in the show notes to learn more and join. I'd love to help you rediscover the vibrant, confident version of yourself.
There's been a lot of chat recently about how poor sleep is connected with lots of chronic health conditions, from high blood pressure to diabetes to strokes and heart disease. There's very clear connection between having poor sleep and having one of these health conditions. But today I want to talk about one of the other really important elements of sleep, and that's the restorative function of sleep in terms of our emotional or mental health well-being. So I think a lot of times we think about sleep and we think of it as like a state of unconsciousness where, our body doesn't move very much and our brain is just sleeping and resting. But in fact, that's actually not really the case at all. And in some areas of the brain, there's actually more activity when we're sleeping than when we're awake. And it's very important that we're cycling through 2 types of sleep called REM sleep and non-REM sleep. And REM sleep is the dream sleep. And it's very important that we have this sort of very balanced proportion of those 2 types of sleep. And we know that if you don't get enough of the REM or dream sleep, that tends to happen sort of 2, 3, 4, 5 in the morning, then we often don't wake up feeling so great, but also that tends to be the day that you're going to have a bad day and be a bit more emotional, or things are going to seem like they're going wrong for you. And have you ever noticed that if you've had a really traumatic or upsetting event happen, and then you go to bed and you actually do manage to have a night's sleep, that it's not like you wake up the next morning and you've forgotten about it. You remember all the details, and you remember with great clarity what exactly has happened in the situation. You do remember all the words that were said and what you said and they said, but actually some of the sting and the sharpness has been taken out of the whole situation. And that's because during the night, our brain has worked really, really hard to, I suppose, take the sharp edges of what's happened. I don't know if any of you have ever seen the movie. It's a kid's movie called Inside Out, and it's such a really great explanation in simple terms of what goes on in the brain and how memories are processed. And sometimes whenever people have very traumatic events and they're not sleeping well, it actually means that it's very, very hard for the brain to sort of file those memories away and allow that pain and emotion and sting to come out of that event that's happened. So I want you to think about sleep maybe a little bit differently. I think we all are quite aware that we're meant to be having this sort of 6 and 7 hours of sleep a night. And I think we all think about it as being a physical rest. But I think we need to remember that it actually is there for emotional repair as well. And there's that softer side of mental wellness that is so important. And if you're not having adequate sleep, then you're not going to actually feel at your best. We also know that there are many things that actually help sleep and many things that inhibit it. And certainly it's a chat for another day, but we know that lots of women will struggle with sleep in the perimenopause and menopause. And we're not going to talk about that today. We're just going to talk about general things that people can do to help their sleep. So one of the things is actually cooling your bedroom down. So they've actually done lots of research, and apparently the perfect temperature is about 18.5 degrees C. So it's probably a little cooler than you think it should be. And that can be sometimes challenging when you live somewhere like we do in Australia, but definitely having a cooler room. So your body has to drop its temperature about 1 degree to actually fall asleep. I think the other thing is, if I think back to the routines that I've had with my 4 children, we often had a real bedtime routine. And, you know, we had a bath, and then we had stories and songs, and everything was really quiet. And I certainly would never have dreamt of letting my children, you know, be playing and then 2 minutes later be sort of chucking them into bed or into their cot and expecting them to go to sleep. And yet that seems to be something that we're expecting ourselves to do. So we're often, you know, doing quite stimulating things. We're watching Netflix, or we're scrolling on our phone, and our brain seeing all this imagery and consuming all this sort of content. And then we're just expecting, you know, to lie down and somehow we're going to flick a switch and go to sleep. And the reality is that more and more of us are struggling to get to sleep. So, you know, as I said, cooling your room, potentially having a shower that's on the cooler side just to help that drop in body temperature. And also making sure, obviously, that your bed's nice and comfortable. And the other thing is to try very, very hard, and this can be easier said than done, to blank your mind. So every time you have that very intrusive thought of, you know, that thing you're worrying about, whether it's money or your job or your relationship or the conversation that you had earlier, is trying to keep bringing yourself back and trying to think of something very, very neutral instead. And I listened actually recently to someone who described a technique of taking yourself on a walk. Now, not literally getting out of bed and going on a walk, but in your mind, repeating a walk that you do frequently. So that may be on the near work, or your walk to the train station, or a walk along the beach, but just doing going through the motions and visualizing yourself walking on that walk. And that's been used in a lot of research, and they've shown that the next thing they remember is waking up the next morning. So that can be quite a good strategy to try and clear your mind of very concerning things. Another thing I talk to my patients about is trying not to have very sort of stimulating or emotional phone calls. So if you know that you know, a friend's having a tricky time, or you know that you're going to have a very stressful conversation, it's probably not a great idea to then think that you're going to go straight to bed afterwards. There's other really interesting research around having a clock in your bedroom, and really the research says that you shouldn't, because actually it doesn't really help you to know that it's 2:43 and you're still awake, and then it's 3:13 and you're still awake. It's actually very, very stress inducing. So in fact, it's probably a good idea not necessarily to have a clock in your bedroom. Ideally, and I will openly admit I am very guilty of this one, is having a phone in the bedroom is not a great idea. But if you must have your phone in your bedroom, I want you to think about using this one simple rule. You're only allowed to look at it if you're standing up. And as soon as you want to sit down or lie down, you have to put your phone back down and put it face down. And that's because, you know, you will not stand and scroll at the side of your bed for more than about 5 minutes. You'll decide you're too tired and you're going to want to go and lie down. So I hope some of these little tips will help. I think we need to think about ourselves a little bit like we do whenever we're trying to get our babies and toddlers into a sleep routine. We need to create something of a sleep routine for ourselves. We need to be dimming the lights in our house. We need to be then having some dark time whenever we're actually trying to go to sleep. So not trying to go to sleep with a TV or lights on, if at all possible. We need to make sure that room's nice and cool, like I said. Try not to have the clock in the room, because it becomes a focus and you become really stressed if you can't go to sleep. If you can, try not to have your phone in your bedroom. But if you must have it, then you're only allowed to look at it if you're standing up. And that definitely, honestly works. And hopefully we also will all take on board that sleep is so much more than just a physical rest for our arms and legs and our bodies. And it's so much more than our brain just, you know, being this sort of blank, inactive space. It's actually a time that we need to set aside. It's restorative. It allows our brain to process a lot of the day's events and allows us to file those memories and experiences away in the correct way so that they don't become an ongoing trauma or concern.
Now, as you know, I've got quite an interest in the peri and postmenopausal period. And I have to say, trouble sleeping is probably one of the most common complaints that I have. And what's also, I would say, quite remarkable is how well these people respond to hormones. It's literally like you've given them $1 million. They come in, they kind of will often skip into the consultation a month later and they'll just be like, I slept all through the night and it was amazing. And I think anecdotally for years we've never really thought of estrogen and progesterone and testosterone as being anything to do with sleep. They've always been sort of labelled as the sex hormones, and people have always thought of them about babies and eggs and sperm and sexual characteristics. But sleep is definitely much more complex than we ever thought. And there's much more things at play clearly than we've ever thought before. I just wonder what your thoughts were on that, and you know, did you have any other little tidbits or anecdotes around that sort of middle-aged woman who's struggling to sleep?
Again, I think what I've said before, if there are changes that are different from where you're at and what you're comfortable with, and if you're not waking up refreshed or you're not having the type of sleep that is helping you function, get to your doctor. I think that would be my first recommendation. Now, in terms of your question about hormones and estrogen and so on, absolutely. So estrogen is really important for quality sleep. It really impacts the amount of time you spend in REM sleep. And so even if you don't get a big change in the amount of sleep that you're getting, you will get better or more restorative sleep. So I'm not surprised that you're getting women coming in, can I just hug you? Because not only am I sleeping better, I'm waking up refreshed. So as I said, less about the amount and more about the quality. And estrogen really changes sleep architecture. A little bit like I said with alcohol, you know, reducing the amount of REM sleep and you're waking up groggy and feeling horrible. Estrogen actually increases the amount of time you spend in REM sleep, and so you wake up feeling more refreshed. even if it doesn't always change the amount of time. So absolutely, I think if it's something that, a woman's willing to try and interested and it's appropriate for them and you could make that decision on their behalf, it's certainly beneficial.
I'd love you to tell us, because obviously you spent such a long time taking a real deep dive into this subject, but any practical tips?
Sure.
Sometimes people feel I think they want to be really warm in bed.
Yep.
Or they want their bedroom to be really warm and really cozy. But my understanding is the evidence suggests actually in ways the opposite. Obviously you don't want to be freezing, but you actually are meant to have a room that's probably a bit cooler than people would expect. Is that right?
Absolutely. So actually you want to be in a cool, dark room. Okay. And the reason for that is it slows down the heart rate and it sort of prepares the body for sleep. And going to sleep in a hot room kind of makes you uncomfortable. You know how it's like the heat of summer, it's difficult to sleep. So you want to find a cool, dark room. Now, if you're somebody who struggles with cold hands and cold feet, and certainly a lot of women do report that, we want to move heat away from the core. So, get something to warm your feet and warm your hands, but have a cool, dark room. And so that would be one practical recommendation, in addition to the ones that I've said earlier, which is make your room enticing for sleep. If it's messy and you just don't want to go there, it doesn't feel like you're going to go to sleep. It's kind of like nice bed sheets, a clean room. I mean, we all know what that is. And I think some of us struggle to do that. And I get that. But the practical is make a room that's conducive of sleep. A cool room is best. A dark room is best. And, keep a regular sleep routine that tends to both, get your body and mind ready for sleep. If you've ever tried to go to sleep 2 hours early because you need to get up earlier, you just can't get to sleep. Your body's not used to that. So keep to a routine. You can't bank sleep. Sometimes you think, all right, I'll just get extra sleep, but it doesn't actually work like that. So keep a regular routine. Make it a bedroom that you want to sleep in, cool, dark, take heat away from the core towards the extremities, and get comfortable. And just change your mindset about sleep. The reality is some people take longer to go to sleep than others. Some people, wake up earlier than others. There are owls and there are larks. There's a chronobiology component to sleep. Do some of the mindfulness aspects so that you're not needing to react. But if you do wake up, don't beat yourself up about it. What use could you do of this time? Could you just let here and just sort of feel cozy and comfortable and let it go?
Rest your bones. That's
rest your
what I say.
bones.
Just rest your bones.
Yeah.
I think one of the other things I often say to patients is if you know that you have late night phone calls with people who wind you up or put you on edge or whatever, politely try and shift that phone call to a different part of the day. If you're going to be going to bed and you're literally arguing with someone in your mind, you're never going to be able to go to sleep.
Absolutely. And women in particular are very sensitive, as I said. Big triggers for women are emotional aspects. We're more emotional. And, a lot of men, of course, it's financial stresses and financial worries about work and so on. Of course, the other thing is the body and mind need to be in sync. So if you've ever tried to go to sleep when you've been sitting all day but you're mentally tired, it's difficult to get to sleep. You need to also be physically tired. So try and get some exercise. And it doesn't have to be anything that's out of what you can manage. I once went to a CBT training and I remember a clinician said, I can't get any of my patients to do any exercise. And they said, just walk out the door, 5 minutes in one direction, 5 minutes back. Get out in the morning and get some sunlight. Help your circadian clock. It does have a critical window. It goes away by about 9:30.
So tell us a little bit about this circadian clock. What do you mean by that?
So the body has a master clock. Actually, if you were to go directly above the roof of your mouth, there's a kind of, what they call the master clock, the circadian clock. And our circadian clock is about 24 hours, actually slightly longer than 24 hours. And we know this because people have been prepared to lock themselves in the dark for several weeks. And instead of it being 24 hours, more like 24 and a half, 25 hours. But basically, we go by the moon and light in the day. And usually we get up when it's light and we go to sleep when it's dark. And as do most every other animal, or at least mammalian animals. And not only do we have a master clock, every cell in your body has its own clock, as you know. And, there's a master one that sends messages to say, and now we go to sleep, and now we wake up, and now we restore. And so that is guided by light. And we know from our retina that not only can we see color, of course, we can also see shade, light and dark, but we've also got photosensitive cells that directly go to the circadian clock. And so it will know even if you can't see. So a blind person can get insomnia. And so our circadian clock is governed by our eyes. But it does have a critical window of lux of when it can capture that. And 9:30 in the morning seems to be about the window. So get up early, go for a walk, get some light in, nice bedroom, nice sheets, cool room, heat away from the core. Don't schedule phone calls with annoying people late at night.
Rita, I have patients who have chronic insomnia, and then we finally get them sleeping and they're really happy, but they still feel exhausted. Is it a bit like being overdrawn at the bank, where it's going to take time to pay back the overdraft because you've had all these months or years of sleep deprivation? Or should it be that sort of within 2 weeks of sleeping really well that you should have built up all your reserves again? Do we know that?
Remember that there is sleep quality, and actually that's what matters more. And so if people are coming in saying their sleep quality or they're not feeling restored, it's well worth having a good check to see what else might be going on, thyroid, etc. But certainly it's the amount of time that they're spending in REM sleep that seems to contribute more to that restorative component. You can't force people to, shoehorn into more REM sleep. These online calculators that say, you've spent X amount of time doing, REM sleep, non-REM. I mean, the body decides what it needs and when it needs it. So I guess if people are still feeling like they're not getting good quality sleep, try and dig down and see what else might be going on. Maybe it is the estrogen, for instance, that actually will increase the amount of REM sleep, and so you feel like you're getting better restorative sleep. I think sometimes people feel like if the numbers match, then it's good. If I'm there and it says 8 hours, why do I still feel tired? Maybe you need more than 8 hours.
Yeah, maybe you're a 9-hour girl.
Yeah, and that's okay. Just need to accommodate for that.
And it would seem remiss to have a whole conversation about sleep without talking about screens even a little bit.
Sure.
Are screens really bad for our sleep, like phone screens, iPads? Is there any good evidence that tells us, is it to stop 1 hour before bed or 2 hours, or what is the recommendation? Do you know?
Actually, the evidence is not as clear-cut as you might believe, as it always is the case. It doesn't seem to be that it's just the light. If anything, actually, most of the research would say that the light itself doesn't make much difference. There have been studies, again, people are brave, where we've had teens where they have, a device like a phone that emits light, and their sleep onset's slightly delayed, but not very much. But if you have scrolling, engaging, texting, messaging, that does make an impact. And so it seems to be that it's engagement rather than the light itself. We're already living in a world where there's light all the time, and so our sensitivity is perhaps a little bit blunted already. So it isn't so much the screens or the devices as much the level of engagement. Now, like everything, some people are more sensitive than others, and certainly keeping a device in your room that's pinging messages is not a great idea. So in line of what we were talking about, a cool dark room, don't keep your phone in your room if it's your alarm. I'll often hear people say, but I'm going to need it as an alarm. No, get a standard alarm and take your phone out of the bedroom, or at least silence the notifications, or something else. So it's the engagement. As far as the evidence is probably slightly weighted on the side of that.
Amazing. And so What's one thing you wish everyone knew about sleep?
That it's okay not to sleep. Unless you have familial inherited sleep disorder, no one's going to die. It's normal to wake up at night. This idea that you go to sleep, you don't wake up again until the next day is not true. We wake up all the time. We toss and we turn, and some nights we have better sleep and some nights we have poorer quality sleep. Do all the practical things, and then if it's still not getting the best night, think about what could I do while I'm here that makes me enjoy this moment.